Welcome. We are junior athletic training students from Limestone University.
Today we're going to be demonstrating various manual therapy techniques, including cupping, instrument-assisted soft tissue mobilization, joint mobs, trigger point release, and active release.
We are very excited to show you the following manual therapy techniques.
Today I'll be showing you how to perform cupping. The indications for cupping include migraines, tight muscles, soreness, and can be used for health promotion, preventative, and therapeutic purposes. The contraindications can include skin lesions, varicose veins, open wounds, fractures, and deep vein thrombosis. For the sake of the demonstration, I'm going to show you how to cup the quad. You'll first put lotion on, and then you'll find where the muscle is tight and place the cup. You'll then do 2 pumps in each one. After placing all the cups, you can then ask the patient if they will like more air. After 8 minutes, you will then remove the cups. Cupping helps to suction the muscle and then bring new blood flow to the surface. New blood flow will then help promote healing to the muscle and release the tension. You can also perform cupping with movement, which can then help release the adhesions that develop between the fascia and the muscle tissue. Just like the cupping of the quads, the cups have now been placed on the patient's back. I will then ask the patient to perform cat-cows, which allows the movement of the back to where the adhesions separate from the muscle tissue.
Today, I'll be demonstrating instrument-assisted soft tissue mobilization. You will use this if the patient presents with any scar tissue, any post-surgical scar tissue, or the patient complains of any tightness or spasms. You will not use this on any open wounds or fractures. To perform instrument-assisted soft tissue mobilization, you will first put lotion or any lubrication on the affected area. And then you will take the tool and you will make sure you use the beveled edge on the skin. And you will apply light pressure and make sure you have a good grip. And typically you will feel any type of adhesions when you're doing this. And you would normally do this for about 5 to 8 minutes, or until you don't feel any more adhesions in the calf. The physiological effects of instrument-assisted soft tissue mobilization is increasing blood flow to the area, breaking up adhesions and scar tissue, and helping the muscle relax. When performing instrument-assisted soft tissue mobilization, make sure you're applying pressure and moving the tool in the opposite direction of the muscle fibers.
Today I'm going to be demonstrating a joint mob, a Maitland grade 3 anterior to posterior talar glide. This should be used when the athlete has a decrease in dorsiflexion and should not be used if there is a suspected fracture. To perform this, you put one hand above the ankle to stabilize, and you put the other hand above the joint line where the web of your finger is on the joint line. Then to perform, you bring the ankle into a loosely packed position and push down. Small oscillations at close to end range of motion. You can use joint mobs to decrease pain and increase range of motion. These can be completed static or with movement. The joint mob that I completed was a Maitland grade 3. There are 5 grades in Maitland mobilizations. Grade 1 is small oscillations at the beginning movement of range of motion. Grade 2 is larger oscillations at mid-range of motion. Grade 3 is larger oscillations at end range of motion. And grade 4 is small oscillations at end range of motion. You can also perform a grade 5. It just depends on if they allow it in your state.
Today I'll be presenting trigger point release. Indications indications for this would be tightness in the region. So today I will be doing the trap. So that could be anywhere a tightness in the upper neck into the shoulder. Contraindications for this would be healing fractures, a blood disorder or blood thinner medications currently, severe osteoporosis, or the pregnancy spot in the foot. For trigger point release, first you're going to ask patient for consent to palpate. Then you're going to first start by palpating to find the area that is tight. So on her, it's about right here. You can tell because usually they'll make a little bit of a face, but it's tender and it can send radiating pains down to the arms or up into the neck. So then when you find the spot, you're going to push down for 30 seconds and hold. We're going to say it was 30 seconds for the sake of the video. You're going to release, give them a 30-second break, and go back at it. You will at one point feel the trigger point release, and it'll kind of feel like a spasm in the hand, but you'll feel the releasing point. You could also find the point and rock back and forth on that to activate the nerve fibers. A trigger point is tightness in the muscle that brings in nerve fibers. The reason this is bad is it will send radiating pain up and down the area for the patient. So a way to find the trigger point is when you find that tightness spot and you push into it, your patient will start having the radiating pain increase. To find out if you have decreased the pain, the patient will report that you might have fallen off the spot or you might have released the trigger point. With that, you'll restart the whole process and go find the spot again, push down, and if that sensation still is decreased, you know you've released the trigger point.
Today I will be performing an active release manual therapy, which is a soft tissue technique that helps release any buildup of scar tissue or inflammation or adhesions that may be a result from a prior injury to the area or overuse of a particular joint. An excess of scar tissue can lead to many other concerns such as pain, limited range of motion, muscle weakness, and potentially numbness and tingling within the affected area. Essentially, you would use this technique to release any restrictions in a range of motion and to modulate pain. You would not want to use this technique when an injury is still in the acute phase or if there is any open wound to the area. To perform this technique, I'm going to take a look at the ankle. This patient has had an ankle sprain recently and there has been tightness in the lateral aspect of the ankle, which has been causing a lack of inversion. So first what you're going to do is palpate and find a tender spot. Once you have this, you're going to move them into eversion. While applying pressure, I'm going to have the patient actively move into inversion and go back and forth. To explain the physiological effects of an active release, I'm going to use an ankle as an example. When you sprain your ankle and the tissues are healing, generally there can be a buildup of scar tissue which leads to adhesions. These adhesions will then create tightness in the muscle, which will lead to a decrease in range of motion and can also lead to muscle weakness. By applying pressure to the point of the adhesion and having the patient actively move their muscle, it'll help lengthen as well as break up any of that scar tissue.
Thanks for watching.
We hope this was a helpful introduction to manual therapies.